I have great pleasure in launching the Health Sector Review 2024. That's it. Let us first acknowledge the traditional owners and the custodians of the land that we sit on, or stand on this morning. Wano Suba, Turantu Suba, and the people of Rewa, Marambalan Roktunuketi, and the Bunivalu. We pay our respects to their chiefs, past, present, as well as emerging leaders, and members of the Bunua and Donbai, and Sanabo Turango Rewa, who may be present here today. We acknowledge their role in caring for the Vanua and its environment, and also its hinterland that will come into prominence as we continue development of this capital city. Distinguished guests, ladies and gentlemen, it is both a privilege and a singular honor for me and a singular honor and responsibility to be here this morning as your Prime Minister, or as Prime Minister of this country, to launch the Health Sector Review, which is a critically important initiative in the shaping of the future of healthcare in our nation. The review has been made, and the findings and report presented today by the World Bank, and it gives us an opportunity to reflect on the current state of our healthcare system in Fiji. It has involved studies, comparative analyses, and historical data processing to find objectively grounded findings that can be used as conducive foundations for futuristic planning for health and solutions to anticipated health challenges and trends brought upon us and the people of this land by the impacts of climate change, lifestyle evolution, and universal and globalized dietary changes. It is a significant step in understanding the challenges we currently face in healthcare, while at the same time identifying opportunities to build a system that delivers care with compassion, excellence, and high standards. What necessitated the review? For some years now, the successive governments of Fiji have been voicing their and echoing the people's concerns about not only the quality of health of the population, but also the quality of health care, especially publicly funded and available to the public of Fiji. With that situation, the Ministry of Finance, the Deputy Prime Minister was here with us this morning. The Ministry of Finance, Strategic Planning, National Development and Statistics, under the Deputy Prime Minister, Professor Biman Prasad, requested the government to approve that a review, and as a result of that review, proposed a real strategy, reset the strategy for the healthcare sector in Fiji. And government agreed that the World Bank be approached to carry out that review. And we are grateful to the World Bank. It is really grateful for all. Fiji is really grateful for all the assistance from many people and organizations, especially those that are acknowledged specifically in the World Bank document being launched today. Distinguished guests, ladies and gentlemen, good health is both an intrinsic human right and is vital for socio-economic growth. A healthier population means greater productivity, stronger families, and a more thriving economy. Yet as a nation, our statistics are alarming. life expectancy in Fiji is just 68 years. 9 years on average behind our upper middle income country peers and below the lower middle income country average of 69 years. And non-communicable diseases remain a major public health crisis, costing Fiji approximately Fiji dollars 591 million annually. These challenges are compounded by the lack of investment in primary health care systems, which hinders our ability to provide early prevention and early effective treatment. While the coalition government transitioned into office, we reflected on what we can do to improve health outcomes in Fiji. What do we have to do to make our healthcare system truly fit for purpose? Ladies and gentlemen, transformative action requires us to have a deep understanding of the root causes of the problems we have. Tailored solutions must be informed by evidence, data, global good practices, and an understanding of our fiscal space and specific strengths and challenges of our nation. It is with those in mind that our collaboration with the World Bank resulted in the undertaking of this critical health sector review. The findings of the Fiji Health Sector Review and everything about it are data-driven and confirm that we face major economic and public health challenges. The presenters this morning confirmed that Fiji's health system is neither appropriately structured nor equipped to prevent and manage our alarming disease burden. I hear similar stories from Fijians every day. Those who have lost loved ones prematurely or travel long distances to seek treatment. The report findings and recommendations are clear and now require our urgent action. It provides us with a roadmap by identifying the key drivers of health system underperformances, which, once addressed at scale, will enable us to pivot towards desirable and better healthcare outcomes. The government has started to act. We are developing. We have increased salaries for our hard-working healthcare workers, and we have started to strengthen healthcare facilities in Fiji. We have established partnerships with our various stakeholders, like the International Women's Association, who continue to work brilliantly, improving facilities across wards in major hospitals across the country, and with the support of the Australian government in the plans for the upgrade of the Colonial War Memorial Hospital. But business as usual will not suffice. We need a paradigm shift, a coordinated, practical approach that unites government, partners, the private sector, and our individual ordinary citizens to drive the needed change. I began my speech by underscoring the importance of collaboration in this sector. Let us embrace scientific knowledge and advancement in this sector while fostering our natural human compassion by looking out for one another. Let us use this launch today as a call to action at all levels of society to respond to the emergency we face from NCDs and growing health risks compounded by climate change. If we rally ourselves as a nation, we can become healthier and more productive, extend our life expectancy by 10 years, which is a critical driver for Fiji to achieve economic ambitions. I don't know whether I can last another 10 years, but even now at 76, I'm struggling. But I think we should. People will feel better at 76 than I do now. I'm deeply grateful to the World Bank that are represented here today for their commitment to their review and their partnership towards the implementation of its recommendations. I urge the relevant government ministries, such as Finance and Health and Medical Services, to operationalize the recommendations of the report and accelerate the implementation plan. I also call upon all our development partners to forge a strategic and financial partnership to support our bold actions as we move to implement the key recommendations of this review, which will serve our nation today and in generations to come. And I urge all fellow Fijians to start adopting a healthy and positive lifestyle and well-being. Let me also take this opportunity to extend a hand of partnership to our Pacific Island nations to coordinate our investment to tackle NCDs and rebuild health systems that benefit our citizens. Transformational improvements in Fiji's health system will also benefit our brothers and sisters in other Pacific countries who rely on Fiji's health system for access to diagnostic, specialized care, essential medicine, and our universities for the training of Pacific healthcare workforce. We need to work together to empower the people of Fiji through unity, to leave a legacy of progress, and healthcare is the common denominator in all we want to do. It is the core. The health sector review proposed innovative ways of how we can amplify the impact of our reforms for the benefit of the other Pacific Island nations. Distinguished guests, ladies and gentlemen, I would respectfully request that all cabinet and assistant ministers and government workers note the executive summary of the report. It says that the Fiji government requested the World Bank to conduct this systematic review of the health sector, take stock of its current performance in tackling Fiji's major health challenges, and propose policy suggestions and programs for improving its performance. The Ministry of Finance, etc., and Ministry of Health working group engaged for the review looked at health financing, including health expenditure for the next 5 years, service delivery, readiness assessment at all levels, health resources for health and the HRD projections to 2030, and consideration of private health care providers to improve health outcomes. Secondly, Fiji is an upper middle income country, but having health outcomes of a lower middle income country and a catastrophic disease burden from non-communicable disease. Fijians enjoy a relatively low out-of-pocket expenditure on health, a feature that Fiji should seek to maintain and enhance. I noticed the review team did not mention our ability as a nation to socialize a lot, and communally share our stress burdens, stress exposure. Their fourth observation is that Fiji's ability to reap its full potential is dependent on ensuring that its working age population remains healthy and productive, and in productive employment. I'm writing my autobiography. Now just looking at years in 10-year lots. I started in 1957, was my last year in district school in the village. 1967 was my last year in boarding school as a head prefect of that school. 1977 was my last year playing rugby for Fiji. 1987, people didn't want to talk about me. 1997, a lot of people were talking about me, about the constitutional re-engineering in Fiji. 2007, I was in church in the village when the Tuirara announced men will tomorrow go and help the Taltala cut his copra. So in 2007, I was cutting copra with the village men for our Taltala in the village. 2017, I was back campaigning to re-enter Parliament as leader of the opposition in 2018, and now looking at the possibility of maintaining or remaining a legislator in 2027. If we can do that, we can plan in 10-year lots like that and live it. This report and its after action will be successful. It's a measure of its success. They also observed that managing Fiji's burden of NCDs is essential to harness our demographic dividend and strengthen our fiscal position. And they warned, their last summary, they warned that if Fiji continues its current trajectory of epidemic NCD levels, health spending needs are projected to reach about 7% of GDP by 2050. That is a warning which should make us all sit up and listen and read this observation from the Health Sector Review of 2024. Let us work together as we face the common challenges of our health system and are at the front line of direct impact of climate change on health, on the health of our people. God bless you all. God bless Fiji.
Sambula Vinaka. Prime Minister, I'd like to first acknowledge your presence and your gracious gift to us in joining us today to launch this report. We know this issue is very close to your heart. We know this is an issue that you and your government have put forward as one of the most critical areas that you want to do some fundamental changes to improve the lives and opportunities of Fijians. So we're very grateful that you've joined us this morning, and we look forward to working with you and your government as we move forward. Good morning. It's great to be here among many friends, and as the good pastor has said, frankly, among the Samaritans who will help Fiji to the next level of being a healthy nation. So thank you for joining. Honorable Prime Minister Rabuka, Honorable Deputy Prime Minister and Minister of Finance, Professor Prasad, Honorable Minister of Health, Dr. Lala Balavu, Pacific and non-Pacific government representatives present, Honorable Ambassadors, representatives of civil society, academia, and international organizations, ladies and gentlemen. It is my distinct honor and privilege to be here today as we gather to launch this Fiji Health Sector Review, an important diagnostic for Fiji to inform a transformation of the health sector and improve the health outcomes of all Fijians. The World Bank accepted this task of conducting this review because we know Fiji is a nation that has ambitious goals for social and economic growth, and for whom the largest boost to growth and jobs will come from reforms that target human capital improvement, particularly through improved health and education outcomes for its people. Honorable Prime Minister Rabuka, I might look a bit young, but I'm not that young. When I go to my doctor, she always tells me she has bad news and good news. Probably more good news since I'm standing here in front of you today. But I think for Fiji, this is a bit more complex. So we have here good news, bad news, more good news, and better news. The good news is that since independence, Fiji has made great progress on a number of important measures of health outcomes. Let me highlight just two of these. On child mortality, or the number of children that die before the age of 5, since 1975, the number has fallen by 50%, from 54 to 27 children for every 1,000 life paths. Other countries of similar development or income levels, that number has fallen from a very high of 81 to 12 per 1,000 births. On maternal mortality, or mothers dying from pregnancy-related causes, the number has fallen from 49 to 38, a 20% drop from the year 2000 to 2020. While for countries of similar development as Fiji, it has fallen from 96 to 62. Very high numbers, but still 33% drop in those 20 years. There are many other indicators that Fiji has been making progress on in health outcomes for its population, as you will see in the report. However, Honorable Prime Minister, the bad news is that the pace of improvement on these numbers has been low and has been outpaced by challenges and by stagnation in modernizing the system in Fiji. As you'll have noticed in the numbers that I've given, although there's been progress, the progress has not been enough. The progress has not been enough compared to the other countries. So you're making progress, but not as fast as the others who are your peers. Life expectancy. Since independence, while life expectancy has improved, this improvement has stagnated for Fiji, even as Fiji has gotten wealthier, while we would expect it to be rising substantially. Between 1990 and 2020, 30 years, life expectancy rose from 66 years to 68 years. So 2 years improvement, about 3% increase. However, this is lower by 1 year compared to countries of lower economic levels. 1 year of lower economic levels, where for them, this has increased from 60 to 69, a 15% jump in those 30 years, while it's been only 3% for Fiji. Among its peers, which is where you belong, Fiji is behind almost 9 years in life expectancy. For those countries, it rose from 68 to 76. So about a 15% increase would have made Fiji expected life expectancy 75 years if it had done what the lower income countries had done. That's the bad news. Even more challenging is that with non-communicable diseases such as diabetes, cardiovascular diseases, cancer, Fiji confronts a true epidemic, a real emergency. Incidences of NCD are almost double what other countries of your economic level have. 80% of deaths in Fiji are caused by NCDs, and at a much younger age. This, of course, burdens the health system, burdens families, and of course, burdens the economy. I could go on and on these things, but they are detailed further in the report. But as I said, Prime Minister, there's also more good news. It starts with your recognition, your personal recognition, and your government's recognition that there's a significant problem here, and there's an urgent need for a solution. When Deputy Prime Minister, Minister of Finance, Professor Prasad, requested us to do this report, and I have to say, Prime Minister, it's very hard to say no to Deputy Prime Minister. When he comes to us, it's really hard. He has the numbers, he has the logic, and he's very persuasive. So we could not say no to this. We knew it was a huge homework, cost us a lot of money, and we knew later on it would force us into an incredible ambition. But we were not afraid. So we're really grateful that we were asked. We're very humbled, and we were humbled by the prospect of working together on yet another fundamental issue for Fiji, as we have done before. For example, something that you know very well, the work we've done in Vanuatu on tourism development. So we took this as the similar challenge. What could we do for Fiji that transforms the prosperity landscape for Fiji over the next 5 to 10 years? So we're very grateful of the trust the government placed in us to conduct the sector review. The health sector review serves as our collective baseline for the health system challenges you face, to see where we can then improve. It sets the pathway for Fiji adding another 10 years of life expectancy to its population, and therefore building a healthy nation. And it proposes the trajectory of how to get there. It provides policy reform recommendations, suggested programmatic investments, and invites coordinated action from within government and development partners. Let me close with the better news. The better news is that This work has already been started by the government of Fiji through a recent adoption of promising policies that promote healthy behavior. We have also joined hands with Australia and the Asian Development Bank on an ongoing master plan for the CWM hospital. There's also a lot of work that development partners are doing in various areas of the health sector. Looking ahead, the World Bank is committed to translate this report's recommendations into action and to help transform Fiji even further on the journey of becoming a center of excellence for health provision in the region. We've started work to design the program. We've started work to mobilize what we hope to be at least 650 million Fijian dollars to assist Fiji to deliver on this vision of the sector transformation with strengthened primary healthcare system as its foundation. We have further committed to working with our partners, many of them present here, to help Fiji begin the journey to build a new hospital that would be a regional health center for Fijians, but also for the region, the Pacific region as a whole. A center of excellence that will provide high-class care, not only for Fiji, but for the other Pacific Island countries, recognizing Fiji's already established leadership as a source of healthcare for many Pacific Island countries. We expect this program to go over the next 7 to 10 years, with the first project beginning by September 2025, 10 months from now. And we welcome other partners to join the World Bank, Australia and the ADB to accelerate this by working together. Given the ambition and sense of urgency to act, the World Bank has tasked a global team of experts based here in Suva, and you will see some of them in the later presentations, based in Sydney and other places in East Asia, as well as in Washington. And they will develop a programmatic investment platform which fosters a coordinated approach among all development partners and support Fiji to operationalize the findings of this sector review and achieve that broader vision that the government has begun to articulate, to which we subscribe fully. Our aspiration is to support Fiji to turn the current challenges in the healthcare system into an opportunity to build a global example of a health system which Pacific countries can benefit from and learn from in the future. Honorable Prime Minister, tipping my hat to your previous profession, I can say we've reported for duty. Thank you very much. Vinaka Vakaleva.